Hello, everyone. So today we'll be practicing on providing mouth care for an unconscious person. So what you will need to do is wash your hands, knock on your patient's door, ask to if you could come in. After that, you'll introduce yourself. So you'll be like, "Hi, my name is Moises. I'm your first assistant for today, and I'll be providing mouth care for you." And you check their ID. After that, you want to gather your supplies. So you would need two large towels, gloves, gauze squares. You would also need a tongue depressor, tape, a table barrier, so you could set your stuff on top of that, or paper towels. You would also need a disposable mouth sponges. So for that, I would use about 3. So let's pretend I have those. You will need a toothbrush if they still have their teeth. Otherwise, don't worry about the toothbrush because you'll use this, the mouth sponges. And you'll use mouthwash. Sometimes you won't use that, so always check the care plan, and a lip balm. All right, so let's see. So we check the breaks. We gather the supplies, we set up the table barrier, we put the supplies on top of that. You want to check the brakes, make sure it's still locked, and you want to position the patient to a Fowler's position. So this is like let's say 90 degrees. You want to do about 30-degree angle. That way they're not too high, but not like where they're going to be choking on the water and stuff like that. So you set them up. Before you put on the gloves, you put a towel on their chest and one on their back. That way they don't get themselves dirty as well. So you put on your gloves and you want to make sure you have their face facing towards you, and then the basin by their cheek. So the excess water will just drop here. So you want to fill up a cup with water, or you want to fill it with half water and half mouthwash. And before that, you want the tongue depressor. Put the gauze around it, tape it, because you're going to open the patient's mouth and put it in there. That way it's easier to work with their mouth. Okay, and you do not want to put your fingers in their mouth because they could bite you and it's going to be hard sometimes to take it off, and it's just going to hurt. So let's say you already wrapped the tongue depressor with gauze and tape, so you're going to insert that. You did that already. So let's just pretend that this patient doesn't have any teeth, only dentures. So you've taken that out. That's its own other care. So you would use 3 mouth sponges. You'll use the first one, dip it in there, and you would start brushing, is that the word? Scrubbing, brushing their gums and their cheeks. You'll use the second one. You always rinse, so you dip it in that, and then you will use it for the roof of the mouth, the upper tongue, and the under the tongue. And then the third one, you will use it for their lips. That way they stay moist. Okay, and you would use the towel to pat dry. You always want to pat dry. Okay. And as you're doing this, you always want to talk to your patient because remember, they're unconscious. They don't know what's happening, so you just want to make them feel as comfortable as possible. So you'll be like, "Hi, Mr. Smith. I'm gonna be scrubbing your gums," or "All right, now it's time to scrub under your tongue." And then, even if they're unconscious, you always try to provide or try to promote independence. So you could be like, "All right, try to spit now," try to make it as normal as possible, or something like that. If they have their teeth, you still would use whatever's in there. So the mouth, half mouthwash, half water, and just scrub, brush their teeth. And always have the basin so the water comes out, pat dry. Okay. So now we did that. So after you're done with that, you would offer them lip balm. For the conscious person, I feel like you still put it on, but always check your care plan. After that, just remove the, if they do a lip balm, just put it on there, or get another, maybe this time get a Q-tip and just, get a little bit of that and then just put it on them. So you take off the dirty towels and you put it in the hamper, and you lower their bed for safety. You check the brakes, you open the curtains, you let the patient know where the call light is at. You clean up your station, you wash your hands, you record and report. Thank you.